Good day, everyone. Welcome to Reversing Vascular Damage with Glycosaminoglycans. To discuss this topic is the Chief, Division of Cardiovascular Medicine, UP-PGH. Let us all welcome Dr. Eugenio B. Reyes.
Greetings to everyone. I'd like to say thank you to Corvich for inviting me today to interact with you and discuss an important topic that many of us are not aware of. Let me begin by sharing with you my slide. This slide is just a picture of an endothelium that is healthy on the left side with a healthy glycocalyx, and on the right side is this destroyed glycocalyx because of infusion with glucose or sugar. And so, as you can see, a plain glucose can damage an endothelium or its glycocalyx. These are my disclosure. And what I'm going to discuss, of course, is how to reverse vascular damage using glycosaminoglycans. These are my objectives. I'm going to describe the structure and function of the glycocalyx, discuss the mechanisms of actions of sulodexide, which is composed of fast-moving heparin and dermatan sulfate, and present to you the clinical trials of sulodexide on vascular diseases, including COVID-19. So what you are seeing right here are GAGS, or glycosaminoglycans. And in the human body, there are at least 6 different types of glycosaminoglycans that are participating in many of the metabolic and physiologic functions of the body. And you can see here heparan sulfate, heparin. They are major components of the glycocalyx, hyaluronic acid, keratan, chondroitin, which is plentiful in the joints, and dermatan sulfate, skin, and other vascular structures. If you look closely, this is the structure of a glycocalyx. They are composed from the inside as proteoglycans, protein with glucose, and outside are glycosaminoglycans. The GAGs that I have presented to you in the first slide, they are intertwined together to build up a hair-like structure, which I will show here to you, an electron microscope of a blood vessel, a capillary, and you can see the hair-like structures there lining the endothelium. In the past, we realized, we thought that the endothelium, a single cell lining the blood vessel, is the one protecting the blood vessel itself. But now we realize that there are structures, hair-like structures, protruding, composed of glycosaminoglycans and linked to the endothelium through the proteoglycans. If you spread this and put a stain, you can see that it is bigger than the endothelium. This hair-like structure is the one that is causing all the balance inside the blood vessel. Balance coagulation and anticoagulation, balance platelet and antiplatelet action, balance vasoconstriction and vasodilation, and anti-inflammatory response. Now, there are different morphology of the glycocalyx depending on the site of the organ. Like, for example, I'm showing to you here a capillary from the brain, the heart, and the lungs. If you look closely into the electron microscope, the glycocalyx here show different structures. It is thinnest in the lung capillary, medium in the heart capillary, and thick in the brain capillary. You can see also on the top pictures the structure of these capillaries without staining of the glycocalyx. But when you stain the glycocalyx, look how thick they are. They are very thick, thicker than the endothelium in itself, right? And the thickness of you can see here how thick the glycocalyx in terms of tissue differentiation. It is thickest in the brain and thinnest in the lungs. And of course, you know why the lungs, it is thin because of exchange of carbon dioxide and oxygen and other gases. Now, as a summary, I'd like to say that the glycocalyx is a structure, part of the endothelium that balances everything. It balances everything. When you need coagulation, it will cause coagulation. For example, you get wounded, you need to coagulate, it will cause coagulation. When you need anticoagulation, it will cause anticoagulation. So that it keeps the blood vessel healthy all the time. That's the role of the glycocalyx. Now, in the past, we thought that the endothelial dysfunction is the lack of nitric oxide, but now it's still the same. However, we now have a structural explanation why endothelial dysfunction happens. It's basically the destruction of the glycocalyx. But the destruction of the glycocalyx, the hair-like structure again, from the endothelium, can happen if you have all of these conditions. If you have all of these conditions, these structures get damaged. Of course, there's a normal wear and tear. In 5 to 7 days, if you damage the glycocalyx, it will return in itself and return its function, protecting the blood vessel. However, if there is persistent damage, then the natural healing to return or to resupply the components of the glycocalyx is prevented in that case. So these are all of the conditions that may cause a degradation of the glycocalyx. And so far, there is only one enzyme that can degrade the glycocalyx that we know of. But these are all of the certain interventions that we can do to protect the endothelium or reverse the glycocalyx damage. Now, the next that I'm going to discuss is the glycosaminoglycan sulodexide. What is sulodexide? It contains 80% iduronyl glycosaminoglycan sulfate and 20% dermatan sulfate. So the iduronyl glycosaminoglycans composed of all of these kinds in structure, different randomly associated with each other, function as a fast-moving heparin. And the other component is dermatan sulfate. So how were you able to achieve this? Through, of course, purification process. And with the purification process, you come out with 80% and 20% of these two components. Now, what's the function of the fast-moving heparin? This is different from the commercial heparin that we are using. Why? Because this fast-moving heparin, as the word itself, fast-moving, behaves differently. It can absorb through the intestine so that it can be given orally. But just like heparin, it potentiates the effect of antithrombin 3, thereby causing thrombin inhibition. And the dermatan sulfate is an agonist of heparin cofactor 2. So both of them can inhibit thrombin. The other effect of fast-moving heparin and dermatan sulfate is the incorporation of themselves into the endothelial lining as component of the glycocalyx. And here you can see that heparin or fast-moving heparin and dermatan can incorporate themselves into the lining as a tag in this fluorescent sulfidexide tag component, right? You can see how it is identified in a capillary. Now, what's the effect of sulfidexide if you give it? For example, in my first slide, I showed you that hyperglycemia can damage the glycocalyx. Just one passing, it can damage the glycocalyx. And so dysglycemia is a condition where the glycocalyx can get damaged. And true enough, in this experiment, using 10 patients with diabetes and 10 patients without diabetes, they showed that the control have normal glycocalyx dimension. But if they have diabetes, the glycocalyx dimension is significantly reduced. But if you give sulfidexide, a fast-moving heparin and dermatan, you will see that the dimensions increase significantly, and more so with the diabetic population. So this is a sign that sulfidexide can reverse endothelial dysfunction related with glycocalyx damage. Now, I'd like to show to you a side stream dark field imaging. This imaging is recently an interest of research. Why? Because it can indirectly visualize the glycocalyx dimension. What you can see in this view is how thick. What you are seeing are not the red blood cell, but rather the thickness of the glycocalyx. And a high microvascular score like this is a healthy endothelium or a healthy glycocalyx, and a low microvascular score like this, 0.3, is poor or low or unhealthy endothelium. So we can image it indirectly, not only through the electron microscope, but through this new imaging technique we call the glycocheck. And it can be done using a camera that you put under the tongue. Now, sulfidexide is not without clinical trials. There are many clinical trials that were conducted, and I will cite many of them in this slide as a summary. One is the Survet, the popular Survet, which was published in 2015, where they randomized 615 patients with VTE. And they were given 2 capsules BID for 2 years of sulfidexide versus placebo. And at the end of 2 years, there was a 54% reduction in recurrent VTE and a 0 major bleeding case report, which you don't see in any of the anticoagulation clinical trials because they always induce bleeding. The second, the Suavis, is on people with PAD, and the use of sulfidexide for 6 months, it was able to increase the pain-free walking distance and the maximum walking distance. And it has a venous arm where there was the demonstration of complete ulcer healing in 2 months. And this one I was able to experience with my own patient, a post-thrombotic patient with ulcer. And the only thing that I can give is sulfidexide because of high risk of bleeding. The next is the DINAS study, which is in patients with diabetic nephropathy and albuminuria. And the use of sulfidexide lowered the albumin excretion rate by 40%. And this is on top of the effect of ACE inhibitors. The next is the DRESS RCT on people with diabetic retinopathy, where sulodexide was given 1 cup BID versus placebo and observed for 12 months. And there was a reduction in the macular hard exudates, which means that it can prevent progression from non-proliferative to proliferative retinopathy. The last major trial that I'd like to share with you is the IPOV2 trial, which was conducted in the late 80s and early 1990s. And the use of sulodexide was able to demonstrate a reduction in total mortality by 32%, 28% brain infarction rate, and 53% reduction in LV thrombus formation. Now, if you look closely into the population where sulodexide was shown to be beneficial, these are all vascular diseases. And it's not only confined to the arterial, but also beneficial in the venous side, and not only venous arterial, but also capillary, as exemplified in the kidneys and the retina. So it's both macro and micro. So in summary, I would like to say, take-home message, the glycocalyx serves as a barrier. It's a normalizing structure. It balances everything. The glycocalyx is made up of glycosaminoglycans, majority of which are the fast-moving heparin or heparan sulfate. Traditionally, the common risk factors that we see are the ones that damage the glycocalyx. And there is an exogenous glycosaminoglycans that can rebuild the glycocalyx and restore its functions. So far, sulodexide is proven effective in the following condition: VTE prevention, PAD with claudication, chronic venous insufficiency, diabetic nephropathy with albuminuria, DM retinopathy, and myocardial infarction, all vascular. So let me move on and discuss to you an important topic that we are all dealing with, the pandemic. This is COVID-19. If you, the first thing that I'd like to discuss with you is to convince you that COVID-19 is not only a pneumonia problem, it's not only an infection problem, but it's also a vascular disease. In the past years, we now realize that the endothelium can be infected by many organisms, not only viral, but also bacterial. We saw that in leptospirosis and sepsis, and right now we can see it in dengue and endotheliitis related with COVID, just as what is being shown to you in these pictures. You can see the virus inside the endothelial cells. Now, this is a picture nicely showing to us a normally functioning and structurally normal alveolus and blood vessel, and separated by what we call this structure as the pericyte. And on the right side, you will see the effect of SARS-CoV-2. SARS-CoV-2, as you can see, has a high affinity for the ACE2 receptor. And once it gets into the ACE2 receptor, can readily penetrate the endothelial lining through this process. However, if you have a healthy glycocalyx, it will not allow it to enter. Why? It has an anti-inflammatory and anti-penetration capacity. However, if you have a pre-damaged glycocalyx, it can readily penetrate the glycocalyx and cause vascular leakage, coagulation, and inflammation. And that's the reason why you see coagulation spread coagulation with COVID infection, just as depicted in these pictures. Now, SARS-CoV-2 is not the first virus to cause endothelium damage, and you can see that the endothelial damage is brought about by damage to the glycocalyx. And beautifully, in this moving picture, you can see how the virus can cause damage to the glycocalyx and penetrate under the endothelium. That's the reason why we have massive vascular coagulation related with COVID. Now, the glycocalyx, as I've mentioned in the first part, the only enzyme that can degrade the glycocalyx is heparinase. And in SARS-CoV-2, it was demonstrated that it can increase the activity of heparinase. And when the heparinase has increased activity, it will degrade the glycocalyx, which is already damaged in people with risk factors for cardiovascular disease. Now, the SARS-CoV-2 can penetrate the nucleus and take over the heparinase gene and the p53, causing an increased activity of heparinase, just like what is depicted in this diagram. Look at the activity of heparinase, very much increased compared to healthy individual versus COVID, and the heparinase sulfate level is also very much increased. And look at the more severe the COVID is, the higher the level of heparinase activity and the level of heparan sulfate. Now, there were studies related to this with the use of low molecular weight heparin. Look at those who were given low molecular weight heparin. The heparinase activity were reduced, and the higher you give low molecular weight, the greater the inhibition of heparinase. And on the right side, you can see the effect of sulodexide, which is also an anticoagulant, and a fast-moving heparin. With 5 microgram per ml concentration, it can reduce heparinase activity by 50% and 90% at 20 microgram per ml. It approaches zero, total inhibition of heparinase. Therefore, what I'm saying here is that COVID-19 pneumonia is not purely pneumonia, but also a vascular disease. And importantly, it becomes manifested in people with cardiovascular disease, with diabetes, with hypertension, obesity, and aging. So there is a need to protect the endothelium before you get COVID-19. So I'd like to share with you this clinical trial which was conducted in Mexico, where sulodexide was given to people with COVID-19 proven within 3 days of symptoms. They were randomized to sulodexide versus placebo and followed out only for 21 days, 2 cups BID. And these were the endpoints: hospital admission, need for oxygen, and mortality. And the secondary objectives were these levels of D-dimer CRP. These were the inclusion criteria and the exclusion, right? And the baseline characteristics were similar, which means that the randomization was successful. The only problem with this clinical trial was it's a per protocol analysis, and the per protocol analysis was conducted because of the pandemic. This was the primary endpoint. The hospitalization rate was reduced by as much as 29 minus 17 is 12, right? This is absolute. And the need for oxygenation was reduced from 42% to 30%, 10% absolute risk. Mortality was also reduced numerically, but it was not statistically significant. These were all the outcomes, right? But the only significant here were the need for hospitalization, the need for oxygen support. And the D-dimer were significantly reduced, and the CRP were also significantly reduced at 14 days. And the medication adherence was good because of lack of side effect. There was no bleeding reported in the sulodexide arm, just like what we saw in the SURVET study. So the conclusion of this study is that early intervention of patients with COVID with sulodexide reduced hospital admissions, oxygen support requirements. Although no significant effect on mortality, numerically there was a trend towards reduction in total mortality. It reduced D-dimer and CRP. So ladies and gentlemen, in conclusion, I would like to say that the glycocalyx is an important part of the cardiovascular system. It is the one that is actually protecting the endothelium. It is the one that is causing balance of everything that we once thought to be due to nitric oxide plainly. Glycocalyx gets damaged, and the traditional risk factors are the ones that cause damage. And there is a protection. There is a way to reverse the glycocalyx function through supplementation. And the only ones that I have discussed today is the use of sulodexide. And in addition, the effect of sulodexide was discussed in this session, and sulodexide was able to reduce hospitalization rate and the need for oxygenation in patients with early COVID, first 3 days of symptoms, and given sulodexide 2 cups PID only for 21 days. Thank you for your kind attention.